Good evening, everyone. We've been long awaiting this moment. We apologize for being late, but we do have a wonderful session lined up for you. And so we are going to get into it. So I welcome you all to 30 Days to Revolutionize Your Health. We started this series with Dr. Avenel Durand, who has been very knowledgeable in educating us about health and how we can take care of health and being more active, exercising, eating well. And so we are going to continue on that premise, and I can assure you we will learn something this afternoon or this evening rather that will be beneficial to us. Before we continue, I'm just going to invite you all to bow your heads while we pray. Our dear Father, we thank you for this day. We thank you for the opportunity we have to come together to just learn more about taking care of this temple you've given unto us. We ask you, dear Jesus, to be with us. Help us that we may stay in tune to whatever wisdom you want to impart on us. Be with our speaker, that you may just guide him as he speak your words, because indeed health is a part of your word. Continue to bless your people, your church, and as we close the Sabbath soon, help that we may always remember that we're disciples for you, and whatever we learn here this evening, we may share with others. Thank you again, I pray. Amen. So, without further ado, I'm just going to introduce our speaker here. Dr. Davoy Murray, a native of Jamaica, started his education in Jamaica. Then he migrated to the US, where he completed a master's. Give me 1 second, please. Go to daddy. He migrated to the US, where he completed his bachelor's degree in biology at Albany University, that's in Georgia. Thereafter, he went to Indiana University here in Indiana, where he did his medical degree. And his passion has always been to become an anesthesiologist. And so God led him to the University of Shands. That's at the University of Florida, Shands Hospital rather, where he did a residency, a 3-year residency anesthesia. He decided that he wanted to specialize more and learn more about the heart. And so he went on to Cleveland Clinic, that's in Ohio, to complete a cardiac fellowship. So currently he is working at Methodist Hospital, where he is a cardiac anesthesiologist. Previously, he was employed with ACI Group, but currently now under Indiana University Health. Dr. Davoy Murray is very passionate about health, and working in the same institution as he is, I've heard numerous comments how passionate, committed, friendly, and loyal he is. And I can attest to that, being his best friend for over 16 years and being his wife for 10 years, I have seen how he has grown and how humble and well knowledgeable he is and loving. So because of his training and his experience, I have no doubt that he is well qualified to speak to us on the topic of the heart, specifically hypertension. This is a condition that has affected us so often, as especially Black people, and it's very important for us to know how we can prevent it, or if we do have hypertension, how we can manage it and live better life, because indeed a part of our spiritual journey is being healthy. Without further ado, I will welcome Dr. Davoy Murray to speak to us for the next few minutes on cardiovascular conditions, specifically hypertension. Thank you.
Good evening, everyone. To our guests here in the sanctuary and also to our online viewers, just want to extend a hearty welcome to just our 30 days to revolutionize your health seminar series. Dr. Avenel Durant has done an excellent job thus far, and I'll be here on today hoping to continue on that thread. We're talking about heart matters, okay? Issues with regards to the heart, but that topic is extremely broad, very expansive. So I chose to narrow down and more specifically discuss high blood pressure because of the prevalence, but also of the impact that it has. I want to say special thanks to my wife, Kamala, for introducing me. And also want to extend thanks to her as well for helping me in putting this presentation together, just in giving me some statistics and just other key points. So again, thanks to her. I crave your attention, and hopefully for the duration that we're together, you'll be able to learn something that will be actionable at the end. Let's see if we can advance with this presentation. Just a little bit of a technical difficulty here, so bear with me. But I'll just go ahead and continue, and then as the presentation catches up, then we'll be together on the same slide. So, like I was saying, there is a very tight, a very strong correlation between cardiovascular disease and high blood pressure, which the medical term for is hypertension. And for years, medical evidence has pointed to the fact that based on your diet, that the risk factors for both, they're the same. And then whatever these factors are, these lead to a buildup in cholesterol and fatty deposits in our arteries, and then therefore this predisposes us to high blood pressure. So I figure if I speak to you about high blood pressure, then whatever the aspects that you will act on as it relates to high blood pressure, these will also, in the same vein, decrease your risk of other cardiovascular heart disease. So let's speak about some definitions here. Will also, in the same vein, decrease your risk of other cardiovascular heart disease. All right. So let's speak about some definitions. Will also definitions in the same vein. Decrease your risk of other. We will define high blood pressure as a systolic blood pressure that's upper limit greater than 130. Definitions in the same vein. And or the systolic number greater than 80. We will define high blood pressure as a systolic numeric number greater than 130. Definitions in the same vein. And hold on just a second. Even the systolic number greater than 80. We will define high blood pressure as a systolic numeric number. All right, thank you. All right, so from a numerical definition, having a blood pressure of greater than 130 over greater than 80 it basically gives you that diagnosis. Now, the next bullet point is taking an antihypertensive medication. Now, the reason I say this is because I met so many people in my practice who you ask them if they have high blood pressure, and they say no. They say no because their blood pressure is normal. But the only reason their blood pressure is normal is because they're taking their prescribed antihypertensive. So in their mind, they're no longer hypertensive. But that is not the truth, right? So if you're taking an antihypertensive medication, then you are hypertensive, okay? And then also, I put this third bullet point in because sometimes we as a people, we can be in denial, where you tell yourself that if you don't have this quote unquote diagnosis on your medical record, then you're not hypertensive. But if you've been told at several primary care visits that your blood pressure is above these critical thresholds, then it's very likely that you're hypertensive. I mean, there can be what's called white coat hypertension, where only when you're at the physician then it's elevated. But the way to rule that out would be to check your blood pressure in a non-medical setting, such as going to, I guess, Walmart or one of the drugstores where they have these blood pressure stalls, and checking it yourself, or buying a cuff and then doing it at home, or again in none of these situations where there's a medical person, and if it is elevated, in two successive readings, not necessarily back to back, but on two separate occasions, then you do meet that criteria. And of course, if your blood pressure is higher than normal. So again, the goal is to be truthful to yourself as it relates to this. Still on the topic of definition, what is blood pressure, right? So, and could we advance with the slide? Thank you. Yeah. So, on a normal physiologic basis, blood exerts, pressure in the inner lumen of your blood vessels, right? And whenever it has to exert a greater force than normal, then this excessive force is what is defined as hypertension and elevated blood pressure. And then this can sometimes be caused by narrowing of the vessels. Sometimes it's because the blood vessels themselves have thickened, or sometimes it may be because of atherosclerotic buildup, and therefore it's narrowed. But if you think of like a hose that's actually delivering water, if you were to actually put your finger over the tip of the hose and then therefore decrease the orifice, the area at which water comes through, then you recognize that blood goes through the hose at a higher force, at a higher pressure. And therefore, that analogy is pretty much the same in your blood vessels. Just so you have a scope of how large this problem is, we're going to look at some statistics. And this is just so that you can have an appreciation of the impact that it has. So here in the US, about 67 million adults have high blood pressure, and about the same have what's called pre-hypertension, that phase just before, right? And added together, this is about 120 million American adults. That's a staggering number. So based on population, that's about 1 in 3. 1 in 3 individuals have an elevated blood pressure. That is not an insignificant number. But if you think that this is just an American problem, then think again. Because the World Health Organization, they found that about 40% of all adults are affected. So this is worldwide, 40%. Right? And then the World Health Organization also estimates that 9.4 million people die annually. 9.4 die annually from the cardiovascular complications of high blood pressure. Right? So, putting this in perspective, this is about 100 times as many lives as those affected by natural disasters combined. So, we're talking about earthquakes, tsunamis, floods, you name it. This is 100 times more that are affected by these things. So what this means, and just so you understand, I like to make this analogy because natural disasters, they're coming, right? By and large. You have sirens, you have weather forecasts, you have evacuation alerts, all these things when you have some sort of natural disaster coming, right? But unlike these disasters that have all this fanfare associated with it, you don't have this with high blood pressure. And that's why we call it the silent killer, because it has no warning signs. But yet, like we said, it takes about 100 times more lives than these natural disasters combined. So it's a serious public health problem. It's not a discriminator. The prevalence is equal between men and women. And of significance to us in this demographic is that African American adults have the highest rates of hypertension in the world, and this is 44%. Again, not a benign or insignificant number. So, what are some risk factors? Well, age. The older you get, the more predisposed you are to get hypertension, because the longer you live, the more deposits occur in your blood vessels. Just natural aging processes, sometimes just diet and different lifestyle things have caught up with you over the years. Ethnicity, we just spoke about African Americans being 45, 44, at 44%, right? Family history, right? This plays a big deal, and genetic factors. These are kind of not necessarily one and the same, but they're very, very, very related. Now, some of these that kind of don't make sense, but if we talk it through, it will. Lower education and socioeconomic status. I mean, the reason why this is a risk factor is because the less educated you are about your health, then the less likely you're going to be to actually take active steps to keep it under control. And then also, if you're of a lower socioeconomic status, then you're less likely to be able to afford healthy, foods, and your life is that much of survival. You don't have the opportunity to do things that are maintenance, but more just trying to live. So that makes sense. Having a higher weight. For most things, just having a higher weight is a risk factor. Health-wise, you will see that it puts more strain on your body's physiologic system. Low physical activity, that kind of is tied in as well. Tobacco use, psychosocial stressors. Stress is a big deal. I'm pretty sure a lot of people, if they've had to undergo significant stress, will say, okay, they have a splitting headache, or they can feel like their bodies are tense. And that's because your body releases various hormones, fight or flight hormones that are geared to primary interaction. So it's no wonder then that if you're in a chronic state of stress, that these inflammatory mediators and hormones will cause high blood pressure to be a mainstay. Sleep apnea. So again, that is something that is tied in with this. Your body, when you're not resting at night because of sleep apnea, you go into those cycles where you snore, but you're not really rested. You don't get into what we call REM sleep, and then these things over time develop cause stress hormones to be released, and again, that cycle just kind of perpetuates. Of course, dietary factors, which I touched on it a little bit earlier. And these are things such as, your fat intake, your sodium intake, your potassium intake, and of course, alcohol. So, what are the blood pressure categories? So you know what numbers you need to be looking at. These are some categories that we're able to get from the American Heart Association. The guidelines have been updated recently, so this is the more recent and up-to-date one. We said normal is having a systolic less than 120 and a diastolic less than 80, right? Elevated is between 120 and 129, with your diastolic still less than 80. Once you pass 130, but you are less than 139 on your, or you're up to 139 on your systolic, and between 80 and 89 on your diastolic, then that's what's called stage 1 hypertension. And then you now go into another stage, which is stage 2, if you are greater than 140 on that upper number, your systolic, and or if you are 90 or higher on that lower number, your diastolic. And that's, like I said, stage 2. And then there is that very red zone that you're seeing right there on your screen, which is what's called hypertensive crisis, where you're higher than 180 on that upper number, and then you're higher than 120 on that lower number. And there's even another one that's not on that slide right there, which is called hypertensive emergency. And that's when you start having symptoms. Obviously, you would have been higher than these numbers, but when you start having symptoms of end organ damage, such as heart failure or dizziness and confusion, that's when you know your brain is being affected. That's almost like a stroke equivalent almost. Yeah, so that's what's called an hypertensive emergency. And make no mistake, it is an emergency. You need to get that treated right away via an emergency room or urgent care or somewhere. These are not things to joke with. So it's a little bit about causes, which is our next slide. Excuse me. So the underlying cause of high blood pressure is not known in about 90% of the cases. And some people will call it idiopathic. Some people will call that primary hypertension. But in 10% of the cases, it is due to something that is known and fixable. So 10% of cases are what's called secondary hypertension. And then these are diseases such as chronic kidney disease. And there's a condition that's known as a pheochromocytoma, where it's basically a tumor that secretes like epinephrine, those hormones that are, like we said before, the fight and flight responses that mediate the flight or fight responses. So again, these are treatable. Recently, I had a patient who had a pheochromocytoma, where again, this is a young man, young, less than 30, and he had blood pressures, 180s, just somewhere up there, and they were able to find out that he did have this pheochromocytoma. We had surgery, removed it, and his blood pressure normalized like right away. So again, those are 10%. That's not what we're dealing with when we're having this conversation, this discussion here. No, we're talking about the garden variety one that affects 90%, not the 10%, right? And then of course, some of the other things that can cause that 10% would be, if you're on chronic steroid therapy, chronic kidneys. No, we're not talking about those. So we're just going to divert back to our discussion. All right, so as we talk about symptoms, I told you before that hypertension is called that silent killer because for the most part, you don't know you have it. You walk around living, doing whatever you want to do, as young people say, living your best life, thinking everything's normal. And then usually it's not until you have reached an advanced stage that it becomes a problem. And then usually when it's at this severe stage, then that's when it's not as reversible. It is reversible still with some of the things that we'll discuss later on. But again, some damage has been caused. So I was mentioning earlier that you can have like a hypertensive emergency, and then you'll have things such as a headache, you'll have visual disturbances, vomiting, even seizures, right? And at that point, it's very clear that that's what we're dealing with. But for the majority of people, it just continues on asymptomatic. So what tests can we order to figure out that you actually have high blood pressure? For the most part, there really are no laboratory tests. Yeah, so I just put that slide up there just to highlight that point. There's no real laboratory diagnosis. Take, for example, if you have diabetes, you can easily get a finger stick blood glucose, and that's very quite simple to do. Or if you went to a lab, just draw something from an IV, and it will tell you if your blood glucose is above a certain number. Or you can do what's called a hemoglobin A1C that will tell you that your blood sugar has been run over the past 90 days or 3 months. And again, that would be very indicative. But there's no lab test to tell you that you're hypertensive. So again, yeah, things to keep in mind. What are the complications that can happen as a result of high blood pressure? So, starting at the top there, stroke. Stroke. I mean, that's one of the big ones. You have different types of strokes actually. You can have an ischemic stroke, which is caused by a clot that breaks off that goes up to a blood vessel, or you can have like a hypertensive stroke where blood vessels in your brain just rupture because they are unable to sustain the continuous pounding caused by your high blood pressure. Excuse me. Right. And if it doesn't get to that point, you could have just overall dizziness, confusion. Right. So again, neural symptoms. You can have vision loss, right? Hypertensive retinopathy. So a good primary care doctor, whenever you visit, will actually look in your eyes and look to see what your retinal arteries are doing, because that can give them an indication or a sign as to how advanced, excuse me, your blood pressure is. Other organs that can be affected are your heart. Over time, if your heart is pumping against blood vessels that have been constricted, then it thickens, and then you have what's called diastolic heart failure that develops over time, and then that could cause a decrease in what we call the ejection fraction. Thank you. In the long run. So heart failure, right? You can also develop various arrhythmias. Heart attack. Again, the constant pressure that your heart is under. I mean, there's just so much it can take, and then it just gets to a point where it's like no more, right? And then also be in mind that the same risk factors that predispose you to high blood pressure also predispose you to atherosclerotic heart disease. So they kind of work hand in hand, and therefore it leads you down that pathway to a heart attack. Kidney disease. Hypertension and diabetes are two of the most common reasons why someone would have end-stage kidney disease and then have to be on dialysis. So again, same thing. The vessels that supply your kidney and basically that entire vasculature is very sensitive to blood pressure. And again, over time, it just cannot take it anymore, and then you have failure. And then this one kind of gets men's attention all the time: sexual dysfunction. Again, high blood pressure, untreated, uncontrolled, can lead to issues in that arena. There's also an increase in the incidence of prostate problems for people with untreated high blood pressure. And then, though it's not on the screen there, just overall vascular disease. There's a thing known as an aneurysm, not just a cerebral aneurysm, but you can also have an abdominal aneurysm. That, again, the major risk factor for that is high blood pressure. And if you have an abdominal aneurysm that ruptures outside of the hospital, and I mean, not just outside the hospital, just ruptures, I mean, the mortality for that is extremely great. So, again, things to consider. All right. Now, there are several medications that people are on or can be placed on to treat blood pressure, right? There are beta blockers, which again, that kind of slows the rate to your heart and then the impulse at which blood goes through. There are calcium channel blockers, which affect the relaxation of your blood vessels. You have alpha agonists, which again work, they work more centrally, I'd say. There are also diuretics, which that we affectionately call water pills that kind of decrease the amount of fluid in your body. So these are all different things that are targeted. But I won't be talking about medication management today because our goal is to see how we can actually reduce the need for medication, reduce the amount in terms of dosage that you may need, and also reduce the number if that's the case. And for some people, it might actually allow you to get off it completely. Not everyone, but every little bit makes a difference. So lifestyle modifications. One of the big ones up top there is lose weight if you're overweight, because like we said before, um, whenever your body has to work harder, then it compensates. The body is a well designed machine. We were created fearfully and wonderfully, and whenever it has to undergo extra stress, it doesn't just give up right away. It just figures, okay, how can I modify, how can I adapt just to get the job done? And if it needs to work harder to get blood and nutrients to places because we're carrying more mass than we were intended to, then it will do that, but it comes at an expense. So when we are at our optimal weight, then we're certainly healthier and our body has to work less. Another big one is reducing the sodium or salt intake to less than 2.3 grams per day. And we don't even appreciate how much salt we have here in the Western world in our diet. And if you were to just pay attention to what is on the labels of the things that we consume, then you would recognize that we easily exceed that 2.3 grams per day without even trying very hard. So canned foods are actually a very large source of that, right? And then a lot of processed foods, things that we would get in terms of even fast food, and those things are rich, are very high in sodium. So I would challenge you, if you did nothing else, and you only did one thing, just reduce the sodium in your diet, and you'd be surprised at just how much your blood pressure actually responds. Right? Another thing is maintain adequate dietary potassium. And I like to think of potassium as the arch nemesis of sodium, because you don't want your sodium to be high. You want it to be relatively low, but you want more. You want to increase your intake of potassium, right? You also want to increase your intake of calcium, and you also want to increase your intake of magnesium. And we'll talk a little bit more about these three in a little bit, but just so it's on your radar for right now. We're talking about weight loss, and a very good way of achieving weight loss, if you're able to, because we understand that not everyone, the older you get, then arthritic joints and other limitations may prevent you from doing aerobic physical exercise. But if you're at all able, try to do so, and for at least 30 minutes per day, because while this does help with weight loss, what it does too is it also releases some helpful hormones that will allow us to regulate different, what we call, homeostatic mechanisms in the body. It helps us to maintain a healthy metabolism. So again, physical activity. And if for some reason you're older and it's not as easy, some ways that to kind of get over this hurdle, like water aerobics. That's helpful because that won't put a lot of weight on your joints. The buoyancy of being in a pool will kind of help with that, and then you can get some benefits there. Your diet obviously plays a very important part. So diets that are rich in fruits, vegetables, and are low, if at all, dairy products would be beneficial as well. And then, of course, we want to reduce saturated fats and cholesterols. I believe last week Dr. Oran spoke about that. Just kind of take what I'm saying now and add it on to what she has already shared with you. And of course, stop smoking. Smoking has nicotine. Nicotine is a very potent vasoconstrictor, meaning it causes blood vessels to clamp down. And then, as we discussed earlier, that's the whole mechanism of high blood pressure. So, if you are a smoker, then again, this is probably more important than anything. If you are a smoker, this is the most important thing above anything else that I've said. Just because it doesn't just affect your blood pressure, but it affects so many other areas of your life. So, as I promised you, I wanted to talk a little bit more about nutrition. You've probably heard a saying, the age-old saying that you are what you eat, and that is true. You've also probably heard a saying, garbage in, garbage out. That is true too. So, I'm just gonna kind of park here for a little bit before we move on. So we want to say that we want you to increase your consumption of whole plant foods. Whole plant foods. And randomized control trials, some fancy studies that some people with a lot of letters behind their name have designed, constructed, conducted, has shown that your blood pressure is lowered when animal products are replaced with vegetable products in both people who already have normal blood pressure and, of course, in our target population for this talk, people who have high blood pressure. So the benefits are universal. So by increasing your consumption of whole plant products, we're meaning more fruits, more vegetables, more nuts, more beans, and whole grains. So you have an idea. We're meaning rather than eating a French fry, you'd probably be better off eating a baked potato. Does that make sense? Yeah. The more processed something is, the more of the nutrients you lose, and then the more of the bad things that you don't want are being added to it, right? Even though I guess apple juice isn't the worst thing in the world, you have more benefits to be derived from eating a whole apple than from drinking a glass of apple juice. So I hope you're understanding where I'm going with this, right? Yeah, the closer you can stay to nature, the better off you will be. Still continue on these bullet points. Less processed and refined grains, sugars, snacks, and sweets. You've probably heard in Greek mythology about Achilles. Some people say Achilles, some people say Achilles, however you want to pronounce it. Well, this is the Achilles heel of a lot of people, sweets. Even people who are avowed vegetarians, if they have an issue with the amount of sweets that they consume, will find that sometimes it is very hard to maintain their health goals, just because processed sweets are so dangerous. If we can reduce that, then again, that will go a long way in our nutrition. And of course, less red and processed meats, milk, eggs, and cheese. If you can get rid of it completely, even better. But even minimal decreases are useful and helpful. Moderate, even better. So start somewhere. Doesn't matter where you start, but start somewhere. Now, again, continuing with nutrition, and I know I'm kind of, as they say, flogging a dead horse, But I just want to hammer this home, just because sometimes if you get some context or some understanding as to why things are the way they are, then you'll be more apt to actually follow through. So we spoke about diets that are like whole food plant diets, right? And we said beans, fruits, vegetables. Now, one of the reasons why these are useful is because they have high amounts of the three minerals that I mentioned earlier. A couple of slides ago, remember I spoke about magnesium, potassium, calcium? Yeah. So beans, fruits, vegetables are rich in these three. And these things are helpful, extremely helpful in lowering your blood pressure. So there you go. That's a natural way of getting these minerals. You don't have to necessarily go to a health food store or Walmart or CVS and buy the nutrient supplement, because you can get it from nature here. And in addition to the minerals that these things actually contain, they're also loaded with what's called phytochemicals. Now, that second bullet point, I know it has a lot of medical jargon, so please forgive me for all that medical stuff. But for lack of I'm just gonna explain to you the best way I know how. Right. Right. So phytochemicals, these are substances that are not minerals, right? That are active in the body to produce a particular effect. And then one of these things, one of the things that these produce are ACE inhibitory effects. Now, ACE stands for angiotensin converting enzyme. And for those of you who might be hypertensive and on medications, one of the mainstays of hypertensive treatment are ACE inhibitors. So if you have a medication that ends with pril, you're on an ACE inhibitor. So that would be like a lisinopril, right? That's probably the most common one, right? There's one that's called quinapril. And then, of course, there are some others that are called ARBs, angiotensin receptor blockers, that kind of work in a similar way, not the same, but similar way. But long and short, these medications work to downregulate the renal vascular system, and your renal system is such a key part of the regulation of your blood pressure. So these medications target that. Now, what I'm saying is that these plant-based foods actually have ACE inhibitory properties. So you're getting natural ACE inhibitors to do the job that these medications would do. And then if you can get this through your food, then you don't necessarily need a prescription to do it for you. Does that make sense? All right. So I've said quite a few things, and I recognize that time is not infinite, right? So I'm gonna kind of wrap up here with just a few things, just action plans, right? Want us to actually have some goals leaving here. Now, I don't know what part of what I said was most applicable to you, but for change to be effective, there has to be a plan. So one of the things I suggest is, find an accountability partner or support group. Somebody who you can go on this journey, this health journey with. Not just with what I spoke about today, but what Dr. Laurent has spoken about on her prior sessions, or that you will hear in the sessions to come. Whatever you are planning on doing, it's always helpful if you have somebody who can walk that road with you. Somebody who will ensure that you guys can both strengthen each other, right? The word declares that iron sharpens iron. So it's the same, if your goal is to exercise more, then get an exercise partner. If one day you're feeling, kind of sleepy and you don't want to get up out of bed, then that person might give you that motivation. If it's something that you're trying from a doctor standpoint, let's just say something that you as a household, if you're doing, then your accountability partner, maybe your spouse or your children, again, together in your household, you can keep each other accountable for, whatever dietary plans you've made. So again, you get the idea. That's one way to get some good resources to help guide you. And a website that I find extremely useful is nutritionfacts.org, right? Nutritionfacts.org. I mean, there is just so much there about high blood pressure, about cholesterol, about heart disease, about diabetes, so much. And, it not just gives you information that's just information, it gives you also helpful ways that you can actually make changes. So, again, I would recommend that website, but that's not the only website. There are also a lot of really good books out there as well. The Methuselah Factor, which is kind of what, or um, series is entitled, is the name of a book that is also pretty good. So you could find that on Amazon. The author is Dr. DeRose. Again, a very good resource. Also, another thing, action plans is develop a specific plan. I mean, when I say specific, make it very, pinpoint and concrete. Like if you have like a big overarching idea, then you're very likely to not do anything, right? But make it specific with a orderly approach, and then also make it realistic. Know what you can do, know what you're limited by, and then just do what you're able to. Start somewhere. You can't do everything, and as you start somewhere, then you may build up to be able to do more things. But the key thing is just to start with that which you're able to do. Just pick a low hanging fruit. And since this talk was primarily about blood pressure, if your goal is to lower it, then you want to know where you're starting so you can know that you're getting better. And then that too can be a motivational factor when you're recognizing just how much better you're getting with the changes that you've implemented. So measure your blood pressure frequently. To be accurate, you want to minimize that white coat effect that I spoke about earlier. So, check it yourself at home, right? Where there's no external pressures or factors that would cause it to be elevated. Use an automatic blood pressure, which I think has been calibrated and works pretty well, because other methods are more subjective. So, but an automatic one is set up in such a way that it should give reliable, consistent readings. And then you want to make sure that the blood pressure curve fits you properly, because if it's too large or too small, then again your readings can be inaccurate. And also be mindful of the setting. You don't want to check your blood pressure after you've just rushed in from a busy day at work. It'd be nice to kind of set yourself up so you're getting good readings. I'm not saying to cheat, because there's really no way to cheat with this, but you want to do it right. You want to make sure that you're sitting, that your arm is pretty much at the level of your heart. It's checked that way. But if you're hustling about, or you just run up some stairs and then check it, then I mean it will be higher than what it should be, and then therefore give you unrealistic reasons to fret. So let's say with these action plans, I want you to take them, I want you to internalize them, and do your best to maintain your health, because health that is preserved is so much more valuable than health that you're trying to regain. The Lord has entrusted us with our bodies. We are stewards of it. And therefore, everything we do, we ought to do to His name's honor and glory. I thank you so much for your time. I thank you so much for your attention. And at this time, I'm just going to open the floor for any questions. All right. So, not hearing any questions, which is okay. So, this time, I'm just gonna have a word of prayer as we close this session. Please bow your heads with me. Gracious Heavenly Father, we thank you so much for the opportunity that you've given to us to be here on another evening to just learn more about this body that you've created for us that's truly fearfully and wonderfully made. I recognize that sin has prevented us from having perfect health. There are so many factors that come into play that pull at us. Some of them we have no control over, but the majority of them are modifiable. The majority of them are lifestyle factors as it relates to our health. So pray, God, that you will give us the wisdom to take care of our bodies. Give us the discipline. Give us the perseverance and the resources, the tools, everything that we need just to be our best for your name's honor and glory. We thank you for the individuals who have been able to come out on today, those who are viewing via our online platforms, that you'll just continue to bless them in an immense way, that you pour out your spirit, that you will help them to be the very best versions of themselves every single day. Continue to be with the rest of our series. Bless all our subsequent presenters. And we pray, oh God, that when all is said and done, and you shall come to take your people home, that we will be in your numbers. This is our prayer with thanksgiving. Your son's precious name. Amen.